So I am now delighted to introduce our panel for you. Please welcome, first of all, Mr. Ong Ye Kung, the Minister for Health for the Republic of Singapore. Please join me. So the slight flaw in the arrangement here, of course, is there's no space for anyone to walk. Please come and sit next to me. And if you take this chair, Minister, thank you very much indeed. And I'm pleased to welcome Catharina Boehme, the Assistant Director General, External Relations and Governance for the World Health Organization. Thank you very much. Welcome, welcome, Catharina. And Deborah Waterhouse, CEO of ViiV Healthcare and President of Global Health at GSK. You take the seat next to Catharina. We were, as you might have noticed from the programme, hoping to have with us a representative from the Ministry of Health and Population for Egypt, but unfortunately the Assistant Minister for Health and Population was unavoidably detained and couldn't join us today. But nevertheless, we have an excellent panel, and I'm delighted to have you with me. Thank you very much indeed. So, Catharina, we're going to let's look at progress towards the Sustainable Development Goals first. And Catharina, this is your wheelhouse. Rather unfortunately, the WHO has just released the most recent results report. Dr. Tedros saying that those results indicate we are way off track to reach the SDG health goals. What do you think are the key things we now need to focus on to bring us back on track?
Well, thank you so much, and let me also take the opportunity to thank IFPMA for the invitation, and thank you all for being with us so late in the evening. So before talking about where we lack progress and what we need to do, let's perhaps quickly say that a lot of progress was made and has been made, and that was possible with innovation at the heart of it. And perhaps just 3 examples. As Sanya has said earlier, the rollout of the HPV vaccine has started in 58 countries and has made excellent progress since we at WHO launched the cervical cancer elimination initiative. The highest number of TB patients was treated ever last year, thanks to an all-oral drug-resistant regimen. And thanks to the help of many of you, we have doubled the global surveillance capacity through COVID, and we've also doubled the genomics capacity in many countries. Having said that, and as Sanya has said, we are confronted with a lot of challenges, and at the current pace, we'll clearly not meet our sustainable development goals and the health-related goals also in particular. So our member states today at WHA adopted what we call our general program of work, our new 4-year strategy. And that strategy particularly seeks to adjust to the challenges we see out there and also to the stalling of progress that we see in many areas. So, just to give you a few examples, you're all very aware of the mega trends we have out there: climate change, aging, migration, the evolving geopolitics, the trust deficit that you touched upon. So all that, is what we try to capture in there, and of course, solving that fully relies on partnership. Maternal mortality has stalled now since 2018. We see a complete flatlining, and will not change that without being able to strengthen primary health care services, access to primary health care services. The NCD, non-communicable disease burden, we now have 41 million people dying of NCDs every year. And while we've made a lot of progress on the infectious disease side, the same is clearly not true when it comes to NCDs, which now are equivalent to 74% of global annual mortality. So, as many of you have already said, this calls for new partnerships and new approaches. And I think my DG would be the first to say that we at WHO have not done enough of that in the past. We've learned a lot during COVID. We were an organization in the past that, someone once said to me, we had a private sector phobia. But Dr. Tedros has clearly changed that, and I think has driven culture change over the last years on that. And so we're really proud to have this new strategy, which outlines tangible progress, aims to save more than 40 million additional lives together with our member states and together with partners and all of you in the room.
Thank you, Catharina. It's a little bit of a grim picture. I wonder if I could impose on you to ask something that I was going to share with the audience with our Egypt guest, because Egypt has been recognized as the first country in the world on course to fully eradicate hepatitis C by 2030, which is clearly a shining example of something that can be achieved. And I wonder if you would have a few words to share with us about how Egypt managed to do this with a massive nationwide screening and treatment campaign, and whether that is the kind of model that can be replicated.
Yeah, I wish he were here to talk to you, because I feel only he can describe properly, the magic in what happened. But indeed, so for us at WHO, this was one of the main successes we celebrated for 2023, which was, the reduction of hepatitis C by more than 90%, and the way Egypt has done this with a combination of local innovative approaches, digital approaches, but really at the heart, a deep understanding of their communities, training of healthcare workers, right? So it's just a really good example how they strengthened healthcare systems, how they deployed innovation, and how they worked with their communities and used information campaigns, etc., to make this happen. And so it's an inspiring example for many of us.
It is, yeah. They took one thing and they tailored everything around it and made it work. Catharina, thank you very much. Well, one of the key challenges we talked about again and again, and we were talking about it with David, is access. Access is such a key word. Access to healthcare services, access to products. So let's discuss how partnerships can deliver that. And I'm going to bring you in here, Deborah. Tell us how ViiV and GSK are working to make sure that patients can get the products they need. And if we look at partnerships which facilitate that, what are examples of successful partnerships?
So thanks for inviting me to be part of the panel tonight. So I'll give you a few examples of partnership. And actually, I've just come from an event where we're celebrating 10 years of partnership with the Medicine Patent Pool. So what happened 10 years ago, we had an incredible HIV medicine called dolutegravir, and we made a commitment, which is the mission of our company, to leave no person living with HIV behind. And that meant that we, from day one, had to make sure that we had a plan to ensure that dolutegravir would be available whether you were in New York, London, Kinshasa or Nairobi. And actually today, through partnership with the Medicine Patent Pool, UNAIDS, UNITAID, WHO, so MedDocity, who I've worked with for like 10 years on this, was there. Like everybody that you could imagine came together and made this commitment to ensure that dolutegravir was broadly made available. And today, 24 million people of the 28 million people on therapy globally who are living with HIV are actually taking a dolutegravir-based regimen. So I think that's a really great example of where you can do well and deliver for your shareholders, because we've had to do that, as well as do good, which is ensure that you are absolutely committed to access. We then went on to do pediatric formulations of dolutegravir, and now we are just starting the rollout of cabotegravir for the prevention of HIV acquisition. So in the HIV space, I think partnership with all of the organizations I've just mentioned, and of course community, has been critical. And we've got a similar kind of mindset around malaria and TB. And of course, AMR, antimicrobial resistance, is the other very hot topic. So between GSK and ViiV, I think we've got a very clear strategy with access at the heart, and we're a big vaccine company as well. So I think we've just delivered up to 1.2 billion doses of vaccine to Gavi over the last X years. We keep a little counter as to how many have been delivered, because we imagine the impact that it makes every day to people who will benefit from those vaccines. So without partnership, you will never deliver any global health benefit.
Wow, so that is clearly a very effective partnership between GSK and Gavi. So effective partnerships are those with organizations with the right capabilities, the right reach, the right local knowledge. So thank you very much indeed for that. Minister Ong, if I can come to you. Like all countries, Singapore's health system is becoming increasingly burdened. How vital has collaboration with the private sector been? How are you addressing that burden? How are you improving patient outcomes?
There's several questions in one.
Just a very, yes. Well, how are you? Let's start with the first one.
Well, I try to answer all of them. I would say the pharmaceutical industry, medical devices industry, is a major industry in Singapore. Yeah. We have attracted many players around the world to invest in Singapore. We are honored to host them, and they produce not just for our market, but the entire world, and as well as the region. And as for our healthcare system, the entire healthcare system is a result of partnership. The government doesn't produce pharmaceutical products or drugs or any of the devices that we use in a hospital. So everything is a result of different expertise, private and public, coming together. I would say healthcare, I've been around many ministries. Healthcare is the most complex, and which I think the partnership is the most tricky to maintain, but yet it's so vital. You asked something about burden, and indeed...
Yes, I mean, so the burdens on a healthcare system is growing, aging populations, yes. Things like that, which are just putting healthcare workers under more and more pressure.
Not just healthcare workers, the entire economy. If we just imagine as a family, let's say a small family of 4, 2 parents, a child plus a spouse, all you need is one parent falling very sick, and suddenly the family stop functioning. Someone got to stop work, got to be a caregiver, and everything turns upside down. So that's just one family, but imagine this happening at a national scale when the population ages, with a higher disease burden, the economy, the entire functioning of the society get dragged down. And fiscally is a significant problem. Our healthcare expenditure is rising. Thankfully, it's not too high, still under 4% of GDP. So I think we have headroom, but yet it's not something that we want to rise tremendously. The private sector and the industry plays a big part, because we are seeing, as David was mentioning, breathtaking advancement in medical technology and healthcare technology. Diseases that were hitherto unable to be managed or cured, now there's a treatment. But I then have to caution that as we entered into this partnership between government and industry to tackle something as serious, mega trends like aging, we have to understand something very unique about the healthcare sector. In all other sectors, innovation means higher productivity, crashing of cost. Let's look at semiconductor industry. As you pack, according to Moore's law, pack more and more transistors into a microchip, every 2 years you double the number of transistors and you halve the cost. And that went on for decades, and that created computers. We all have computers in our hands. I'm holding 2. One's for work and one's for my wife. And costs just crash, and we can do so much more with so little cost. But that equation doesn't happen in healthcare. The language in healthcare is entirely different. It's not about productivity, efficiency, but it's about how much more are we prepared to pay for better health outcomes. indeed, we are delivering better, more life years, more healthy life years, but we are also spending more, which means we have two major trends piling on top of one another. One is aging, with more demand for healthcare, more NCDs, and the other, healthcare technology, which make available much higher cost treatment for an aged population. How do you square that? I think that's the major problem, major challenge that the government face.
Ms. Rong, thank you. And we'll talk a little bit more about innovation a little later on. Let's talk about partnerships that can help advance healthcare now. And Catharina, how is the WHO partnering to make sure innovation is delivering for those unmet needs, which the WHO is prioritizing? And do you think, well, I know you know that more can be done. What more could be done?
Well, so let me perhaps start by saying that at our World Health Assembly this year, we awarded a lifetime award to Katie Kariko. I don't know how many of you know her, but she's a Nobel Prize winner for her work in mRNA. And we did this specifically to acknowledge and recognize science and the value of science and research and development, and did this to acknowledge that almost everything was slowed down during this pandemic, but what was not slowed down was science, and in fact it accelerated. And so, you know, I think when I look ahead, indeed, the challenge we see is we had 40 countries decreasing their healthcare spend last year. The healthcare budgets are going down instead of up. You know, Singapore is an exciting example, but it's clearly not been the norm over the last years. And so to harness the promise of science, the promise of R&D, and the promise of innovation, we have to focus on creating the capacity in countries and the health systems, and make sure that health financing remains a priority.
Particularly in low and middle income countries, where that is going to be key to being able to achieve the SDG goals.
Absolutely. So for us at WHO, you know, the new strategy is very much about strengthening our country offices, making sure that our norms and standard work translates into actual adoption in countries, into actual, you know, translation into national guidelines and an implementation. And that's where you've already heard a lot from Sanya about the partnerships between Global Fund, between Gavi and WHO, UNICEF, a lot of other entities here in the room. So that will certainly be key, right? We need science without cutting-edge technical products. Will never tackle the NCD problem, diabetes, obesity, cancer. Without digital transformation and AI, we'll never achieve our UHC and health system goals. Without medical innovation, we'll never control AMR. I'm sure all of you have heard a lot this week about antimicrobial resistance here, also with the upcoming UN General Assembly meeting. Without vaccine innovation, we'll never reach disease elimination targets that we've set for the next years. And we have a thick and rich vaccine innovation pipeline that we hopefully will be able to harness on. And without the private sector, we'll not deliver on any of that. But then from there, how do we create the flip side, and how do we create the ability in countries to absorb this innovation? And how do we work with the running engines, as Sanya called them, Gavi, Global Fund, to make sure that we get these innovations in the hands of people quickly?
Well, maybe let's get the view of industry then. So how do we sustain innovation, Deborah, for the next generation of treatments and vaccines, and get them to those underserved populations?
I mean, I think there's two parts to talk about there. You've got the thing that the industry does really well, which is what you've just referred to, which is innovation. And certainly you can see in both communicable and non-communicable diseases huge innovation. And so for us, what we've been thinking about is we have an organisation that is committed to spend around about £1 billion on diseases of low, middle income countries over the next 10 years, and we're about 3 or 4 years in. And what we've actually learnt is that the first thing is decide where you're going to focus. So where are you going to have the biggest impact? For us, we've decided on HIV, malaria, TB, and antimicrobial resistance. And then you go and you speak to your partners and you say, okay, so we're looking broadly in these spaces at both small molecule medicines and vaccines, and you together decide where the biggest health impact is likely to be. Because actually there's no point having a vaccine that Gavi doesn't want, or that the WHO won't pre-qualify or ultimately support. And so from my perspective, you start many years before the medicine will come anywhere near the market, and you have that ongoing dialogue to check that you're all in pace with one another, so that when that vaccine comes, or that TB medication, or that malaria medication, or a solution for AMR, that you're actually all ready together to step forward. And I think in the HIV space, I heard David talking about it, actually, despite the kind of the faltering steps we had at the very beginning of the epidemic, that actually is a very slick machine now, where people all work together, industry, supranationals, community, governments, to make sure that when the innovation is there, the funding and the infrastructure to get it into the arms of, or the hands of, people who would benefit actually is all in sync. So I think we've learned a lot of lessons. The place where we're probably less prepared is the non-communicable diseases, because at the moment governments are struggling with, you know, the infectious disease side of things, and aren't really in a position, in least developed countries particularly, to embrace opportunities in non-communicable diseases. And that's probably the next frontier that we do have to focus on, as well as obviously AMR. But prevention is better than treatment, so the more we can do with prevention, the more headway we'll make.
Thank you, Deborah. Minister Ong, from a high-income country perspective, we always think of Singapore as being at the cutting edge of new technology. How is Singapore embracing emerging technologies?
We have to embrace it. As I mentioned, I described the dilemma, because the more you innovate, sometimes it costs even more. The burden actually increases, but that doesn't mean we have to stop innovation. In fact, we have to continue to embrace it and support it. And in this partnership, I think what government can do most, the government doesn't innovate, to be honest. Yeah, it's the industry that innovate, the scientific community that innovate. What government can do is to invest in basic research, foundational research, which often provide the basis for industry innovation, and share those research findings openly with industries. Second is, when there is research findings, protect the IP. It can sometimes be counterintuitive, but the more you protect the IP, the more it can do good for people. Just look at the issue of vaccine inequity. Some has a reaction that to ensure vaccine inequity, let's make sure the IP is distributed freely to everybody. But it's really not a kitchen recipe that you can replicate easily. But in fact, the more you protect the IP, the more investments you are likely to attract to produce vaccines when you need it. In Singapore, post-COVID, we had quite a strong patent protection regime. We are able to attract 6 production facilities in Singapore. Our needs are small. It's a small country. A few days of production probably will satisfy our need, but so we have no illusion that whatever we attract, IP of which is protected, the production is for the region and the world. So this is how we intend to embrace and to support innovation. But it still doesn't solve the dilemma I mentioned just now, which is a real one, And I wanted to put it out there so that industry knows what are we preoccupied and burdened with. I think the answer is what Deborah mentioned. There is one way to square the circle, which is to focus on preventive care. And with prevention, we need not, and there is so much innovation in prevention. With AI, with digital technology, with genomics, I think we are seeing a very exciting breakthrough in medical science, but channel the energy in preventative care, and I think we can possibly embrace innovation, but yet contain healthcare costs. That's my hope.
Well, I'm sure industry will be lining up to talk to you to discuss ways of doing that.
We do have a queue in Singapore.
So we are coming to the end of the discussion, and just before we take questions from the floor, I want to ask all of you one last question. Please give a brief answer, if you would, 1 minute or less. If you had a single lesson to share for driving progress in global health, what would it be? Minister Ong, can I come to you first?
Industry do what you do best, which is you do have a profit motive. Nothing wrong with that. That's part and parcel of the modern world. Do what you do best, innovate, but government needs to have the right policies. Often, without the right policies, best innovation cannot work. With the right policy, even mediocre innovation can go a long way.
Good point. Thank you. Catharina?
Perhaps from a partnership perspective, my approach would be, let's celebrate small victories and let's have a very candid and honest tone, right? We had a lot of partnership meetings this week, and my experience is what helps a lot is making partnerships very concrete, be very clear on the joint objective, and then celebrate what there is to celebrate, but also be very clear about what doesn't work. And I think that opens a lot of ways forward.
Thank you very much indeed. And Deborah?
I would say that without partnership, innovation will stay on the shelf and not in the arms or the body, and that is a waste of resource, and therefore putting yourself in the shoes of others with whom you partner, understanding where they're coming from, and then stepping into your shoes to see how you might do things differently, I think can make a massive difference.
Thank you very much indeed. Now, I'm sorry to say that I think we're going to lose you because you're a very busy man and you won't be able to stay for this next part. Is that right?
I have to go to a dinner. I may catch the dessert.
Are you able to stay for a couple more minutes, or are you?
Oh, I can.
Oh, that's very good. Because I was going to say, we've actually made it very difficult for you to leave the stage. You would have to vault over the table.
That was part of my consideration.